A very good evening to all of you. I welcome you all for today's very important event. International Menopause Society celebrates World Menopause Day every year on 18th of October. This day was designated by IMS to raise awareness of menopause and support options to improve health and well-being of the women in midlife and beyond. Various organizations, professionals, and women are all encouraged to participate in this global awareness program raising campaigns. Indian Menopause Society, Psychiatric Society of Nagpur, Manch Sudha, which is a forum for midlife women wellness, they are all delighted to be the part of International Society's campaign. This year's theme is cognition and mood, and so a very interesting panel discussion has been organized on brain fog at menopause. Next slide, Manju. So today we are really fortunate to have a towering personality, a very charming personality with us, Dr. Sunila Khandelwal as the chief guest. She is a member of Board of Trustees, International Menopause Society. Madam has made a presence of IMS felt at international level and represented India in various capacities at international level. So it's a real proud privilege for me to introduce such a dynamic personality. She is a senior consultant and gynecologist with vast teaching, clinical and administrative experience for over 38 years as faculty at government and private medical colleges of Jaipur. She is a director of Midlife Women Healthcare and Menopause Center, Fortis and Apex Hospital, Jaipur. She has held excellent professional positions and peer recognition in societies and organizations, both nationally and internationally. She is the pioneer of first menopause clinic in Rajasthan. She is the founder editor of Journal of Midlife Health, and she is the recipient of various awards. The list is too big, but I would like to mention an award of excellence by International Menopause Society for remarkable role of General Secretary camps, and she is honored most prestigious international Lucian IMS Camp Award in 2018 for achievements in furthering women's health. So, and she has a great passion to work globally for midlife women health care with IMS, and so her mission is mainly converting miserable life into meaningful one. So looking at her biodata, you can make out we are so fortunate to have such a person as a chief guest. I welcome you, madam, in this forum and request you to share a few words with us.
Thank you so much for the kind introduction. It was not needed at all because this is the day and we are all here to celebrate World Menopause Day and holding the responsibility from the International Menopause Society. I bring greetings both from International Menopause Society and Indian Menopause Society for this particular day, and thank you for your warm invite, especially Dr. Alka, and your enthusiastic organizing this seminar, this webinar. And I know this is, for last 18 years I'm working at this platform, and every year we run the campaign. But the true meaning of campaign is to really raise the awareness and also to do the dedicated services, charitable services to all mature women who are still not aware about the options. So basically this day is dedicated to the millions of the women, those who are entering into this second phase of the life, the golden era of their life, but still they are unaware about how to improve the quality of life. So definitely I wish this day and also all of you to join this campaign. And of course the theme of this year is very, very important in day-to-day life and improving the quality of life, because we have Definitely the brain fog is the person is in a lady who is entering to this phase really decreases the self-esteem and confidence. And I'm sure the toolkit which is being provided, it will help all the clinicians and healthcare workers working in this field to improve the brain health of these women. So thank you so much, and I wish all the best for your campaign and for this success of the webinar. The panelists give us the insight about the tools, also the right direction, how we should manage. So all the best, and thanks for the Psychiatric Society who has joined to Indian Menopause Society. Thank you so much. All the best of luck.
Thank you very much, madam, for your kind words. And whenever I'm working in IMS in so many years, and I looked up to you as a role model, that how much work you are doing. I think in future we should be able to reach that level. Thank you.
Today also we have did 10 things. I was just counting. We released posters. We have done pre-menopause clinic consultation, distribution the leaflets. We had webinar. We had dance exercise for improving the mood, and we did meditation also. And of course, everything was like fell into place according to the theme. So I'm really happy. The end of the day is also with a wonderful webinar with all of you. Thank you so much.
Yes, very nice, very nice. Now I welcome Dr. Sagar Chiddarwar, Manju CEO, yes, the guest of honor. It's my great privilege and honor to introduce Dr. Sagar Chiddarwar, who is the President of Psychiatric Society of Nagpur. As Madam has already said, we must thank you for joining this campaign. He is a consultant psychiatrist at NV Clinic Nagpur. He is the director of Asan Hospital Nagpur, and he is a recipient of Marfatia Gold Medal of Mumbai University. And he was ex-associate assistant professor IGMC. So with this, I welcome you, sir, and I request you to share a few words on this occasion.
Thank you very much, Dr. Sotaman, for that kind introduction. 18th October, World Menopause Day, highlighting one of the most important transition phases in every female's life, I must say. But if we see the reality apart from the doctors, there has been hardly very much awareness is lacking about this an important topic, and I must appreciate people at World Menopause Society and the Indian Menopause Society to put in your efforts, to put in your time to raise awareness about this important topic. Apart from doctors, I find people at large, public at large, are hardly too much aware of this, and even if those who are aware, including the doctors, apart from gynecologists also, people are not much aware of the psychological aspects, the changes that usually occur during this phase and after this phase. So I must congratulate the World Menopause Society to come up with this year's theme, which highlights the cognition and mood, the way you think and the way you feel. So in this phase of menopause, so I hope with this much initiative, they should add a little bit to the perspective and knowledge of people who are the august audience who are participating in this webinar. And from our side, who can be better to take up this matter than one of my very dear friend and an asset of Psychiatric Society Nagpur, Dr. Sushil Gavande, is here to conduct the thing. And I also welcome Dr. Maitri Romate, a senior psychiatrist from Mumbai, to spare her time and be here with us. And we also have Dr. Pranjali Valmare, a young and dynamic psychiatrist, a part of PSN. So I look forward to an interesting and enlightening session of this panel discussion. Thank you.
Thank you, Dr. Chiddarwar. Thank you for joining us. Menopause is multidisciplinary management. So it is not only us, but we always, most of the time, require your help as a psychiatrist. So thank you very much for joining here. Now, I would like to welcome Dr. Pai. Dr. Abhijit Pai and Dr. Alka Kumar, they are going to moderate today's panel discussion. Welcome, Dr. Abhijit Pai. He's the assistant professor. Yeah, he's the assistant professor at NKP Singh's Institute of Medical Sciences. He's the honorary secretary of Psychiatric Society of Nagpur, and he was EC member, IPS Friends Group, and consultant psychiatrist at National Cancer Institute, Nagpur. Definitely, we'll have a very interesting session along with the gynecologist, Dr. Alka Kumar. Manju, Dr. Alka Kumar, yes. It's a great privilege to introduce my dear friend, Dr. Alka Kumar. First, what I remember when I look at Alka, she is a hardcore worker and at grassroots level worker, very passionate about spreading awareness, and she is conducting many awareness programs. So I always salute her work for this. She is a consultant gynecologist, preventive oncologist, and wellness specialist. She is practicing gynecology since 30 years, and she was the assistant professor at RDG Medical College, Ujjain, from 2016 to 2018. She has contributed chapter in many of the menopause books, and she is a member of International Menopause Society. That is very important, and that's why we are here for this program today. She has taken tremendous effort to organize this program. At present, she is the president of NARCHI Nagpur chapter, and she was past president of MNS, vice president of Nagpur OBGY Society, and member of Public Forum Committee (POXI) since 2013 to 16. She has presented papers at international and national conferences, and she has got Best Free Paper Award at IMS Conference 2018, Bharat Excellence Award, and she has been featured. Her name is featured in Asia's Pacific Who's Who. So we have a real good moderators with us today. So welcome, Alka, and over to you now.
Thank you, Dr. Kantan Suri, for your warm welcome address and the kind words. Respected Chief Guest, Dr. Sunila Khandelwal, Guest of Honor, Dr. Sagar Chitterwal, the organizing team, and all the participants, I welcome you all to this panel discussion on brain fog in menopause, organized on the occasion of World Menopause Day 2022. My special thanks to Dr. Sushil Gawande for guiding us on this topic, cognition and mood. So cognitive complaints are frequent in midlife. They decrease the quality of life. Menopausal symptoms like vasomotor symptoms, sleep disturbances, and mood changes contribute to the cognitive difficulties at midlife. There are many questions and there are critical gaps in the data as whether the cognition and moods. The goal of this panel of discussion is to provide menopause practitioners and psychiatrists with an overview of data informing clinical care of menopausal women, clinical counseling and decision making for the patients. Next please. So we have eminent panelists to answer all your questions. First, I welcome all the panelists. First panelist is Dr. Sulba Joshi. She is a consultant gynecologist, ex-HOD and professor at LMH Nagpur. She is a past president of Indian Menopause Society, and also she has a lot of publications in journal. Next. Our next panelist is Dr. Maithili Omate. Welcome. She is Associate Professor, Department of Psychiatry, JJNC and JJ Hospital, Mumbai. She has completed MBBS from Tutiwala National Medical College, Mumbai. She is MD Psychological Medicine from SAIL GSMC and KM Hospital, Mumbai. She has done a PhD Psychiatry from National Board of Education. Our third panelist is Dr. Pranjali Waghmare. She is MD Psychiatry. She is working as an assistant professor at Government Medical College, Nagpur. She is a life member of Indian Psychiatric Society and Nagpur Psychiatric Society. She has done a certificate course in rational behavior therapy, research methodology, and biostatistics, interested in child and addiction psychiatry. So, we have very enthusiastic and eminent panelists who will enlighten us on this topic. So let's begin with the question and answer session, for which I hand over to Dr. Abhijit Payal, Honorary Secretary of Psychiatric Society, Nagpur. Over to Dr. Abhijit Payal.
Thank you, ma'am. Am I audible?
Yes, you're audible.
Thank you so much, ma'am. On this day, Alka ma'am has already introduced the topic. The brain fog as such is not a medical condition, but it's a cluster of symptoms. So let's understand how the symptoms are, what are the cognitive symptoms, and various other queries from the expert panelists today. So without wasting much time, my first question I would like to ask to Dr. Sulbha Joshi ma'am. Ma'am, you must be coming across various patients, n number of patients with symptoms of brain fog, for example, cognitive symptoms and other symptoms. So my question is, how do you identify brain fog? Means, how do you define it and how do you diagnose it?
Unmute yourself. Sulbha ma'am,
Unmute yourself.
unmute yourself.
Before answering your question, Abhijit, I would like to thank Alka, Kanchan and you also for inviting me to participate in this panel discussion. Actually, brain fog is not an actual medical term, as you know. It is described as a list of symptoms affecting daily brain functioning, and it is like your brain is covered with a thin layer, and this is leading to lack of attention, slow information processing, forgetfulness and mental fatigue. As far as menopausal brain fog is concerned, it includes constellation of symptoms which are experienced by women going through menopause. These include difficulty in recalling words and numbers, disturbance in daily life like अरे मैंने यहाँ चाबी रखी थी कहाँ गई, मेरी घड़ी कहाँ गई, absent mindedness, entering in a room and forgetting what for you have entered the room, inability to concentrate, and even forgetting important appointments and events. All these symptoms, they vary in intensity and vary from person to person, female to female, but definitely it leads to anxiety and it affects quality of life of the woman as well as people at home. I think, is it okay?
Yeah. Thank you, ma'am. Thank you so much. Means, overall, what we understood is it's a cluster of symptoms, various symptoms like cognitive symptoms, lack of concentration or memory, such kind of symptoms, and which can lead to the anxiety and affect the quality of life as it affects the daily routine because of the cognitive dulling or the slowness. Right, ma'am? Thank you so much, ma'am. Next question, I would like to ask to Dr. Pranjali. Hello, Dr. Pranjali.
Hello, sir.
Hello. My question to you is, what do we understand by cognition? It means cognition or the cognitive effects or cognitive impairment, I would say. What is that?
Cognition is a higher mental function. It is the characteristics which distinguish us humans from other species, right? So when we are talking about cognition or cognitive process, it is the process, it is a mental process which is associated with acquiring knowledge and understanding the surrounding through various perception, senses and experiences. The domains which are included in cognition, they are learning, thought process, then there is planning, problem solving, attention, memory, and decision making. And when we are talking about cognitive issues, means obviously the involvement of this domains can be affected in cognitive impairment.
Okay. Like means cognition is again it's multifactorial. For example, like it include concentration, attention, judgment, executive functioning, memory, etc. But can you, ma'am, guide about what cognitive domains are usually affected during the menopausal transition? Which domains are usually affected? And second is how to identify those. Means, is there any screening instrument for that to identify the cognitive impairment?
So generally, verbal learning, verbal memory, new learning, these are the domains which are generally impaired. A simple instrument which can be used is MMSE, and simple memory testing with normal interactions, asking regarding what we say, simple words, or trying to see whether they are able to do certain tasks which we are telling them to do, like three-step procedure or three commands, three steps commands.
Okay, thanks, ma'am. Miss, in menopausal transition, mostly affected with verbal memory, concentration, you said, attention, and executive function, like three-step command and all, right? And the simple instrument which can be used at OPD basis or the bedside or the MMS, that is many mental status examination.
Right, sir.
And any other instrument, like I have heard about MOCA, that is Montreal Cognitive Assessment, that can also be used.
Definitely, sir.
So
That
these are
can also
simple
be
tools.
used.
So these are simple tools that can be used to screen what are the cognitive impairment that is there in this patient. Thank you, ma'am.
Right, sir.
My next question is to Dr. Maithili, ma'am. Hello, Maithili, ma'am.
Yes,
Ma'am, there are symptoms of cognitive impairment in brain fog are mainly like cognitive. For example, attention deficit, especially inability to sustain attention, lack of concentration or memory problems. And many symptoms look like the symptoms of adult ADHD. So, is there any doubt whether the patient how to differentiate between whether it's an adult ADHD or it's an cognitive impairment because of the brain fog in menopausal transition? How can we differentiate that?
See, the key factor that we see here, ADHD is the symptom complex which is not new onset. You typically have hyperactivity as well as inattention right from childhood, which gradually over time persists up to adulthood. Generally, the inattention part persists up to adulthood, but whereas the brain fog associated with menopause will be a rather new onset related specifically after menopause than a very long-standing issue. But again, I would want to say that though it is very different, but the symptoms very often mimic as that of ADHD. So the typical inattention part in brain fog is quite similar to adult ADHD. So the woman would have difficulty in, say, remembering things, in paying attention to things. There could be difficulty in regulating emotions, so managing frustration, regulating emotions. There could be a difficulty in keeping themselves alert. There could be deficiencies in, say, processing speed, working memory or recall, which are similar in both. Also, organizing, prioritizing, or say activating, planning work, in that the person might sustain difficulties. So both, yes, it is very different, but some symptoms are similar.
Okay, thank you. I mean, the basic difference is ADHD will be started, it would have started in childhood, and now the some symptoms like inattention has lasted till now, maybe in elderly person or the menopausal person. Whereas the brain fog because of the menopause is a newly started. Thank you, ma'am. My next question is again to Pranjali. Hello, Pranjali.
Yes, sir.
Do all the women during menopausal transition develop cognitive symptoms, or there are certain women that develop any their risk factors are there, or who usually develop these symptoms who do not?
Generally, around 60% of the women who are going through menopausal transition, they are said to develop some cognitive decline, which is not as severe as what we say in dementia. Many studies have happened, and again they are showing the prevalence rate of around 45 to 65%. So what was your next question?
Tell me, do all women develop cognitive impairment, or there are certain group of menopausal women?
No, definitely. But few women who have more sedentary lifestyle, who are suffering from dyslipidemia, diabetes, hypertension, who have more incidence of depression or other anxiety features. They are again more prone for having more cognitive decline, and who are having more better lifestyle, like they are getting engaged into physical activities, who are doing meditation, and who are getting engaged into mental activities also, like learning new languages. These are obviously what we call is, they lead to cognitive reserve, and which helps them to prevent this cognitive decline which is seen around the menopausal transition phase.
Okay, means that the prevalence is pretty high, and the women who are mentally active means they are doing something or the other to keep their brain active, that are less prone, right? Thank you. Thank you so much. My next question is to Dr. Sulva Joshi, ma'am. Ma'am, do these cognitive changes or the symptoms of brain fog, they usually resolve of its own post-menopause, or means how is the course of this symptom?
Yes, these cognitive changes usually resolve during postmenopausal period, at least in some patients. In some patients, they do persist. Memory problems persist in some patients. And, though these complaints are there in 50% of the patients, as was told by Pranjali, in only 10% of the patients, they are troublesome. And women who show clinically significant impairment, if they have the risk factors, they may show persistence. It has been observed that low-income group women, they are more likely to have persistence of symptoms. Maybe because of low income, low level of education, and this puts them on the limited demand of cognition, and that is why they might be having persistence of symptoms. Similarly, those patients who have persistence of menopausal symptoms, like sleep disturbances are persisting, then in these patients also there can be persistence of these cognitive changes. Then other factors like there may be genetic vulnerability, there may be physical or mental problems, there may be life stressors, and these factors may be responsible for persistence of menopausal symptoms. But overall, we cannot say that these symptoms will persist in all patients in menopause. In some patients, they may persist. Majority of the patients, they resolve with help.
In those women who have the persistence of symptoms, are there any other modes of treatment for them?
Yes, there are. Lifestyle modification is important. No?
Right. And do they require psychotropic or psychiatric treatment at any time, or just modification in lifestyle, hormonal therapy, and that will be sufficient in most of the cases?
We usually refer such patients who have really clinical disturbance, they are referred to psychiatrist. As I told you, in 10% of the patients, they may need psychiatric help.
Right. In many patients, symptoms resolve postmenopausally. In some they remain persist, and in those in whom it persists and are severe, they are referred to psychiatrist for further therapy.
But this is the right time. Shall I interfere? When this is the right time to intervene, here we can tell the patient what are the factors or what are the lifestyle changes that can be adopted by these women so as to postpone or prevent the further development of deterioration or dementia. There are certain modifiable lifestyles which can be advised to these women.
We can take advantage of this time and then consult them accordingly for the lifestyle modification. Thank you, ma'am. Now, I would like to request Dr. Alka Kumar, ma'am, to conduct further question and answers with the panelists.
Thank you, Dr. Abhijit. So, my next question is to Dr. Mathili. What are the non-modifiable risk factors of dementia?
Yes, these are the factors which cannot change. So, it is age. So, as the age increases, after 70s, 80s, the risk factor increases manifold. Then is, of course, gender, where women are more vulnerable. It could be the genetic profile and any family history, especially of dementia. specific any genotypes. If there is a history of long-standing chronic illnesses, if there are negative early life experiences, or if there has been any socio-economic adversity, as Madam also said earlier, it is much more common to see cognitive changes in them, or those whom education is lower, so they were having lesser opportunities for education.
Yes, these are the non-modifiable factors, and we have to look upon it. We cannot change, but these are some of the modifiable risk factors. I think so. Heart health is a brain health. So it is better, as Pranjali has already told, that you have to treat your obesity, lipid profile, hypertension, correct your hypertension, diabetes, mellitus, midlife women, and these are the factors which we can optimize our brain health. So this we can correcting these factors, at least we can decrease the risk of dementia. So next question. So next question is to Dr. Sulba Joshi. What menopause related factors appear to influence cognition? Next.
We all know the associations of estrogen receptors in the brain and memory and cognitive function. See, estrogen receptors are plenty in hippocampus and in prefrontal cortex, which subserve memory and other cognitive functions. Now, when the ovaries are removed, bilateral oophorectomy is done, or when the ovaries are suppressed by giving GnRH analogs, it has been observed that there is a decrease in verbal learning and memory, and whenever these women are administered estrogens, there is reversal of these symptoms. So this clearly shows that menopausal depletion of estrogen is one of the factors, most important factor. Other factors are menopausal symptoms like sleep disturbances, vasomotor symptoms, hot flushes, then mood disturbances during the menopause. These are also the contributing factors which are associated with cognition problems during menopause.
Definitely, in surgical menopause, these symptoms are seen more, and estradiol plays an important role in minimizing these factors. If you start a estrogen therapy or menopausal hormone therapy, it do help to decrease dementia or any other problems like this. So, next question. My next question is to Dr. Pranjali Varmare. What is the relationship between exercise and cognition?
When we are talking about exercise definitely has shown to have positive impact on cognition. It is said to improve the neuroplasticity and leading to improved cognition over a period of time. In various human studies as well as animal studies, it was found that older people or people who are getting engaged in physical activities regularly, they are found to have a higher volume of gray matter in hippocampus as well as in frontal lobe. There is increased brain neurotropic factor. There is increased in blood flow of hippocampus. Again, this indicates that there is a better cognitive functioning, leading to a more protective environment for cognitive decline in this patient. When we are talking about exercise, we should also talk about mental exercises. So definitely mental exercises also help, like some word games, Sudoku, or learning new language, acquiring new skills.
Yes, definitely exercise improves our exercise improves our concentration, and always we have learning new languages, so it will help us. That is also mental exercise. Meditation also helps in improving the cognition. Is it so, Ranjani?
Yes, ma'am. Yeah, ma'am. Definitely, it helps in improving the cognition.
Yes. Thank you very much. The next question is to Dr. Sulba Joshi again. What role MHT, that is menopausal hormone therapy, play in improving cognition? Dr. Sulba?
See, menopausal hormone therapy is recommended for menopausal symptoms, severe menopausal symptoms, they resolve after menopausal hormone therapy, and even those patients who have mental brain fog or those patients who have memory problem might show improvement when they are on MHT. But for this brain fog or these memory problems, we do not recommend menopausal hormone therapy. And for that matter, current guidelines do not recommend menopausal hormone therapy for any of the cognitive decline, or that is prevention or treatment of cognitive problems. Premature menopause or surgical menopause, where there is acute depletion of estrogen. In these cases, it has been observed that menopausal hormone therapy may help in maintaining cognitive function and lowers the risk of dementia. Whenever a woman is taking menopausal hormone therapy for menopausal symptoms, there is always a worry, there is a concern whether the patients will develop dementia at a later age. But studies have been done and it has been observed that menopausal hormone therapy does not affect, or it is very safe to give, and it will not cause dementia in future. Especially in early postmenopausal period, if you give any MHT in any form, only estrogen or progesterone, then there is no risk. But it has been observed that in elderly women after 65, if MHT is given, that too combined therapy, conjugated equine estrogen, hydroxyprogesterone, it has been observed that there is a negative impact, deterioration of the patient. But if only estrogens are given, then it is safe to give even in the late postmenopausal period. So the only menopausal hormone therapy access does not play in any role, or it is not recommended for improving cognition, except in surgical menopause. Small number of patients where there is surgical menopause. Yes, we are giving menopausal hormone therapy in these women till the natural age of menopause. So this will help in improving the cognition in these patients. I think I am clear.
So rightly said that actually menopausal hormone therapy alone for cognition is not recommended, but in early menopause, premature menopause, and if we are in the symptoms like vasomotor symptoms and sleep disturbances, hot flashes are all severe, so we start the estrogen therapy, menopausal hormone therapy, and it helps in impaired dementia also. This madam has rightly said. So my next question. This question is open to all. How do you consult the patient? So I think everybody will, all the three panelists will share their experiences, how they counsel this patient. So who will take it?
The most important thing, I will take it.
Yeah.
The most important thing is these patients need reassurance that though these symptoms have been developed, they are going to resolve. Only a small number, only if the patient is at risk, if there is a family history of early dementia and all, then only those patients will be at risk. Otherwise, they need reassurance that there is no risk of dementia in future. That is most important. And as I told earlier also, this is the time when you can intervene. This is the time when you can give guidance about the modifiable risk factors to these women. As Alka has already told, the hypertension, diabetes, hypothyroidism, dyslipidemia, all these things can be taken care of. The woman should be advised to keep her blood pressure level, systolic BP at 120, that will prevent dementia. Then the BMI should be maintained between 18 to 25. Another thing is, this is the period. In India, we do not find smoking or alcoholism in women, but smoking should be totally avoided, and alcohol, it should not be in excess quantity, that we can say. Then physical activity, as has already been told by Maithili, it reduces cognitive decline. So regular physical exercise should be advised. Exercise which increases heart rate and blood flow should be carried out. So how much exercise? At least 30 minutes per day for 5 days in a week. Then exercising your brain. It is like our muscles. If we do not use muscles get wasted. Similarly, if the brain is not, you do not give exercise to the brain, it may also get wasted. So brain exercise is very important, solving sudokus, crossword, learning new skills, reading, learning new language, etc. All this will help to maintain brain health. Then healthy diet, plenty of vegetables and fruits. That will also help in preventing the decline in the mental function. Another important thing is these women should be asked, menopausal women should be asked to stay connected. They should maintain their social engagements and they should be a part of the local community. Then this is the period when there may be some amount of depression or anxiety, and we all know that mental health, there is a link between mental health with depression and cognitive decline. So depression, anxiety or stressors, they should be taken care of, they should be managed properly. Then sleep. Sleep is very important for mental health. Lack of health is associated with memory problems. So these women should be advised to not to have late night sleep. They should have at least 7 hours sleep. That will that will help them in maintaining the cognition properly. Then these are the women who are at risk of, these are the small things which should be kept in mind. Brain injury can increase risk of cognitive decline and dementia. So use of seat belts, helmet, etc. should be encouraged. And one of the most important thing is formal education. Formal education helps to decrease cognitive decline. So she should be asked to take classes in the local college, community center, or also can have online classes. Learning new things is very important, and formal education at this age may help in preventing cognitive decline. So this is the way we can counsel these women for preventing cognitive decline.
So, yes, counseling of women is very important, asking the history also, past history of every symptoms were there, and at what age their menopause has occurred, that is also important. And Madam has rightly elaborated all the points of lifestyle changes and what to do with exercising the brain. And yes, anyone, Pranjali or Anjali, do you want to add anything else to this?
Yes, I would like to add, though Madam has already covered the aspect of sleep, sleep hygiene is extremely important. Now with the advent of soap operas and web series and especially family members coming home late, sleep has somehow taken a backseat, and it's very popular for people to sleep very late or get up very early because they have to make tiffins or there are some daily chores to be done in the morning. So it has to be emphasized that sleep is very important and we need to maintain a good quality of sleep. Secondly, I would also like to add about brain gym, like how we do a physical exercise. We should emphasize to them to engage in more mentally productive activities. It could be a simple Sudoku. For an uneducated woman, it could also be counting beads or something that can keep them moving. And there is of course the role of religion and spirituality, which I would say is very important, especially people who have belief. We should emphasize that they should take more, participate in more, so that their memory improves and also that they feel better. And one more thing is that we should always screen if there is presence of any, as we saw, topic is also cognition and mood. So it is quite common to have it hand in hand, that there could be some depressive symptoms which need to be tackled. Yes, Pranjali, you would like to add something?
Ma'am has covered everything. Just the thing was that when we are saying that cognitive decline is there, it is, the decline is in very minimum level or minor cognitive impairment is there. But during that phase, many patients will come and say that we may develop into dementia or are we developing dementia. So we definitely need to reassure them that dementia at early age is a very rare thing, and if it happens also, there is a strong connection with family history. So that reassurance has to be given, I think. That is it.
Alka, can I add something? Yes. Now a new concept of reversal of aging is coming. I have included that chapter in my book also. In that again, how do we reverse our age? It is basically mainly the key point is exercise or the lifestyle modification. So in menopause management, first and foremost important is lifestyle management. So whenever these patients come to gynecologists in the perimenopausal years, like for some menstrual disorder or something, so as a gynecologist, it is our duty that time to counsel these patients to change their lifestyle. Once they attain menopause, it's okay. Then, but if we start this preparation beforehand, then they can sail through menopause very nicely. So this counseling should occur much earlier. That's what I feel.
Yes, Kanchan, you have rightly said, and we have also started a project Why Wait for 35.
Yes.
In colleges, we give lectures and on menopausal symptoms and how to prepare for them.
Yes.
In degree colleges, and we have conducted a lot of programs on this. So, rightly, we should start and educate our women on menopausal symptoms, and especially osteoporosis and this cognitive function. These are very important and which are preventable
simple lifestyle management.
So simple lifestyle and exercise, modified lifestyle, that will help it. So moving to the next question. So this is a question to Dr. Maithili Umati. What is the relationship between long COVID, brain fog and memory problems, ma'am?
Yes, madam. Now both long COVID as well as menopause, we see both are somewhere correlated to cognition, memory issues, and brain fog. Now the thing is that long COVID, COVID has come very new. It's been hardly 2 years, but it has been seen consistently across countries that COVID is associated, especially people with long COVID, definitely have some memory issues, and this is seen more in women. And the memory issues or the cognitive issues which are seen is executive dysfunction is much commoner. Now, what could be the reasons for this? One is there is a disruption in the levels of estradiol, probably due to long COVID itself, the COVID itself, or even sometimes due to vaccinations. So this in turn is leading to memory issues in them. Now, if you would say that the differentiating factors will be that menopause is specifically associated with brain fog and long COVID, if at that same time because of hormonal disturbances there is an early menopause, so around premenopausal or perimenopausal period, we might have a brain fog like symptoms. So yes, it's a complex relationship.
Yes, when the studies are going on and irregularities in menstruation cycles are associated with long COVID, there are studies going on still. So we have to wait till the studies come out, the results. So next question, please. Next slide. So this question is also open to all. Are women on a path to a dementia once they transition through menopause? Anybody who wants to take this question?
Yes, I would want to take. I would say that no, definitely not. Again, the menopausal time period, the memory issues associated with menopause very often could be short term, whereas dementia is more of a long term chronic problem that we are talking, which occurs at a much later age, and most women who experience menopause during menopause are experiencing cognitive symptoms will not go on to develop dementia. That's why Madam had also said that first thing is that we need to reassure them, especially because if you see that the risk, say dementia, you see it increases multifold with increase in age. So say at the age of 45, the risk is 19.5%, they have found, and by the age of 65 is 21.1%, and by the age of 80 and 90, it becomes much more than that. So normally we need to only reassure women, except for women who are having a family history already of dementia, where we would have to look in. Yes, ma'am.
Yes, rightly, the family history, that is non-modifiable risk factors, that has to be taken into account if they have family history. That is, but many women, these symptoms resolve and they can, by lifestyle modifications, that they can, we can reassure them that they will not, the dementia will not be there. We can reassure the women. So now next slide. Yes, we come to the end of the questions. Next slide. So all the panelists, they have added their experiences and answered all the questions. I think all our participants are got enlightened through all this subject of brain fog in menopause, that is cognitive and moods. So, in short, that is that we have to correct our hypertension, diabetes, mellitus, and keep our BP to 120 to 80, and then avoid smoking and excessive alcohol. Then train the body, do brain exercise. Then always stay connected. That is, be social, learn some new things, and maintain your weight gain. These are the take-home messages. Means we have to lifestyle changes. This we have to follow it, and I think by following all these things, we can maintain our lifestyle at menopause. Very happy these golden years. We can enjoy these golden years of our lifestyle. So with this take-home message, we end this panel discussion. Now this session is open to the house, and anybody has any questions, they are welcome. And to unmute everyone.
Alka, recently I came across an article. There is a growing evidence of links between brain health and gut health, which is influenced by gut microbiota, gut bacteria balance. So, and usually this balance can be maintained by concentrating on diet, Mediterranean type of diet, and I think vegan diet that helps in maintaining gut microbiota. So this is something new which I learned, and I think these psychiatrists will be able to throw more light because they must be aware of this. Maithili and Pranjali. Any idea?
Which diet is better for maintaining the cognitive changes?
Vegetarian diet is said to better, but Pranjali, you can also add.
But everybody can't.
It's all about healthy diet, less spicy diet, less oily diet, which is obviously and more fibers, which will help in controlling your cholesterol level and indirectly will help in reducing the cognitive problems. Having fruits, which will again lead to which have antioxidant property, again they help in inhibition of neurodegeneration or reduce neurodegeneration and leading to reduction of dementia or decline.
So everything comes back to diet, exercise.
Yeah,
lifestyle.
the lifestyle changes back to your diet. That is a balanced diet, vegetarian diet with a lot of antioxidants, vitamins, protein, carbohydrates, and then exercise. Weight-bearing exercise to strengthen your muscles, to avoid sarcopenia, and also skills. So everything, the circle is that diets and exercise and how you are socially connected. That is also very important. So, any questions? More questions? If there are any questions. Yes, Dr. Saga Chittewan, would you like to add something?
That was a comprehensive take. I have nothing to add.
Yes, Dr. Sushil Ravande is there. Hello, Dr. Sushil Ravande. Are you there? So I think all our panelists, they have answered the questions very well, and all our participants, they have understood it, so there are no questions. I hope so they will follow all these guidelines and have a very healthy lifestyle. So I invite Dr. Abhijit Fire to propose the vote of thanks. Dr. Abhijit.
Thank you, ma'am.